Dr. Jonas Apostol.
Hi guys! It's been a while. I mean, the last time that I released my vlog, December. So ngayon, it's February. Happy Love Month. So I hope you guys are doing okay. And for the last couple of months, I was very busy doing a lot of things. You know, dentistry stuff. And ayun. Pero nag-release naman kami ng vlogs. I mean, yung kay Snooki Serna, sila Kong TV. So, marami naman. I mean, it's just that hindi ako nakapag-release ng like cases on my own na in-explain ko the usual. But yeah, I'm here now.
Hello, boys! I'm back!
And I hope you could relate with this case and enjoy. So, this is a very interesting case. So, this patient is actually based abroad. She's on her early 20s and going to be a flight attendant soon. And the thing with her case is that it's a congenital missing teeth. So, may mga spaces that's really affecting not just aesthetics but also functionality and alignment. So as a flight attendant, you have to have a confidently beautiful smile. So that's the reason why she wants to have her teeth fixed. So the patient is already beautiful. So our purpose here is how can we make her look more beautiful, especially with her smile. With this case, there is a partial anodontia. This is a congenital missing teeth and also a big diastema on the two front teeth. So these areas are very sensitive because when it comes to aesthetics, you can be able to see not just the space but a missing teeth, which can be enhanced. So the tricky part of this case is that she's based abroad and then we cannot be able to do an orthodontic treatment because for this type of case, there is a very narrow space for the lateral incisor to be placed in perfectly, because in dentistry we have to make sure that we provide the right morphology of the teeth to make sure that we give the balance and fuller smile. So for this type of case, the perfect treatment option for this one would be orthodontic treatment followed by dental implants after we establish the space. But since she's based abroad and nagmamadali yung patient because of the work opportunity as a flight attendant, then we had to design the case and complete the case as soon as possible. So this is quite challenging on my part because we need to make sure that we give the right sizes, the right morphology and anatomy of the teeth that would be more balanced and would be in harmony with her face. So this is not a straightforward case, but it's doable. So since the patient is only in her early 20s, we have to prepare the teeth conservatively. We don't want to do some invasive reduction of the teeth for a reason that the patient is still young. So after thorough assessment, which is clinically and radiographically, I did the smile design. This is a very technique sensitive because it requires a lot of artistic ability. We're talking about the morphology of the teeth. How can we create something that would match her face and would look natural as possible? We did a combination of designing. We did the wax mock-up and then followed by composite. After placing it in, I modified it with the composite to make sure that it would blend well with the patient's lips and smile. And where should we place the line angles properly to balance everything. So after that, after we have finalized the design and the patient liked it and I liked it also, so that's the time that we did the procedure. So we did not go straight to the reduction of the teeth right away because we are trying to create a design talaga muna, just to establish everything first before we can go straight with the reduction process, because these are irreversible process. So once I start reducing the teeth, that's irreversible, and we have to make sure that we are very strategic with our process and we follow some parameters and protocols. So the usual, of course, we have to anesthetize the case before we prepare the teeth. So local anesthesia, hindi naman kailangan matulog, no sedation at all, with music, and of course, we want to make sure that the patient is comfortable in the chair, and then after that, we did the reduction. So take note, I did not reduce the teeth like a normal crown preparation, although it's a bridge. So I did a very conservative reduction for this case. It's like a veneer-ish, the bridge. So it's very, very durable because I used zirconia. Okay, zirconia as my material, but it's layered with porcelain, high fusing one, to make sure that it's gonna look natural, but with the durability and strength of the zirconia as my core. That's why I can do a very conservative approach for my bridge, because I considered the age of the patient and also the distance from the canine and the central incisor. We have to take note that these type of bridge is different because it can be modified due to the distance ng two abutments. So it's always case to case. Okay, so after the reduction of the teeth, we did the final impression, temporization. The patient waited for a week, and then after that, we try it in and we did some modification, and then after that, the patient agreed with the design and the looks of the ceramics. And then on the same day, after the try-in, we bonded the ceramics to the teeth. So these are combination of bridge and veneers. So as you can see here, a stunning result. It blends well with the patient's mouth. It follows the curvature of the lower lip. It also gave that pointy canine that's really suits to her personality, and also the color of the ceramics. It blends well with her skin tone in the eyes, and also the position of the lips. It's not too bulky, and the volume is perfect, the length is perfect, and yeah, the patient is happy overall, and I'm so happy for it. So at first, the patient was very apprehensive about the possible outcome. Kasi nga, this type of case is not straightforward case. We have lots of issues here. Age is also a factor, it's big spaces. So medyo natatakot siya with the possible result. So I'm glad that it turned out really, really well. So there are a lot of cases, very, very complicated cases, no? But at the end of the day, the approach is different. Pero dito sa clinic, I have my own protocols. So dapat, it should be planned ahead. Treatment planning is very important. Assessment. Kaya we are really trying to incorporate the triad. Okay, we are incorporating the health, the longevity, the functionality, and beauty. So it should be healthy, functional, and beautiful for longevity purposes. So that's how we do it here in my clinic. But at the end of the day, cases are sometimes it's unpredictable, and we're just doing it based on the scientific parameters. But we cannot guarantee or ensure like how it's gonna last, because at the end of the day, it's how you take care of what you have. It's the most important thing. So some of you might also ask if implant is still an option. Yes, of course, 100%. But it requires orthodontic treatment to establish the space kasi there is not enough space for this case. So the patient also has a difficulty with the time because she's not based here and she wanted to have that beautiful smile as soon as possible due to work opportunity. But yeah, we can do implants after orthodontic treatment, because when we do our dental implants, we have to make sure that we get that space for the implant, because if not, it could be a problem. So dentistry is not straightforward. I mean, it's not as easy as 1, 2, 3. We have to be very careful with our decision. We have to be very transparent to the case of the patient, if it's doable or not. We also need to consider some aspect, not just the ideal treatment. Sometimes we need to be more flexible. But at the end of the day, if we cannot do it, then we should never do it. But if it's within the parameters and if it's doable, then we need to, do our best and give the patient she deserves. So thank you for watching this vlog, and I hope to see you guys here at the clinic and to meet you. And let's continue to spread love in this love month. Happy Valentine's!